Hey guys, welcome to my online nursing education tutorial. My name is Sadel Brian Kusani and I'm a qualified professional nurse currently doing my postgraduate nursing diploma in education at the University of Johannesburg. So today we will be diving headfirst into the mysterious world of mental health, a topic which is misunderstood because all of the mental health stigma around this topic, right? Mental health is a very broad field and basically has multiple and many diagnoses and multiple explanations because there's a lot of lack of understanding when it comes to this mental condition. Today we'll be talking about one of the most common mental illnesses called depression. Depression. What is depression? Depression is more like that one guest that crashes your party but does not want to leave until the party is over or the sun comes up. A lot of people who are diagnosed with depression never really understand what is meant when they are told they have depression. But before we kickstart this topic, let me pose you a question to you. When you hear the term depression, what do you hear? What comes into your mind first? Take a moment and jot that down. Now, you might be wondering, why should a nurse like yourself care about depression? Well, let me enlighten you. In this fast-paced world of health, understanding mental health is one big bonus. It's not just a small bonus, but it's a very important necessity. As a future caregiver, you will be on the front line providing comfort and care to patients who are battling with inner demons. Now, you might be wondering, why should a nurse like yourself care about depression? Well, let me enlighten you. In this fast paced world of healthcare, understanding mental health is not just a bonus, it is a necessity. As future caregivers, you will be on the front lines providing comfort and care to patients who are battling their inner demons. Whether it is a bedside chat or a reassuring smile, your knowledge on depression could be the lifeline someone desperately needs. At the end of this lesson, I expect you to know these following outcomes: definitions, defining depression, identifying the different types of causes, basically being able to identify the different types of depression, the signs and symptoms of depression, how it's assessed and diagnosed, the treatment options which are available, and the nursing interventions and care management. So before we get into this, why did the nurse bring a red pen to work? In case she needed to draw blood, but don't worry. Today we're focusing on healing hearts and minds, which is about depression, not drawing blood. So basically, depression is often known as a major depressive disorder, commonly known as MDD. It is a very serious mood disorder characterized by a prolonged sadness, despair, and loss of interest in activities. It influences how a person thinks, feels, and manages daily tasks, including eating, sleeping, and working. Depression can range in intensity from moderate to severe and can greatly damage a person's quality of life if it's not addressed or attended to as soon as possible. So basically, when it comes to depression, there are multiple and various causes. Understanding the cause of depression is very difficult and diverse since it is frequently includes a combination of many factors. But let's look at some of the most common factors which are related to depression. Basically, one of the common factors is biological factors. When you speak of biological factors, you're speaking of things such as genetics, neurochemical imbalances, brain structure. So when you're speaking of genetics, you're speaking of basically family history of depression or mood disorders. These kind of genetics, they increase the likelihood of someone actually having depression because it's genetically inherited. Then when you're speaking of neurological imbalances, you're speaking about, you're considering the imbalances in neurotransmitters in the brain, right? And when you're speaking about the brain, there might be also some changes in the brain structure, which basically causes damage in the mood, in the areas which control the mood of the patient. So basically, since I've indicated these two biological factors, since you've done nervous system, give me examples of neurotransmitters that basically control the mood, and are there any parts of the brain that you're aware of that basically control mood in the brain? Okay, so an answer to these. In the brain, basically, there are neurotransmitters that control mood, such as serotonin, dopamine, noradrenaline, right? These neurotransmitters which you find in the brain, basically, when they are depleted in the brain, they can lead to a person being severely depressed, which is why you have to prevent these hormones from being depleted in the brain, because you can just simply call them happy hormones. right? So they regulate your mood and actually spike up the mood of the person to make them appear to come across happy, right? And then there are parts of the brains which basically control this, which is part of the prefrontal cortex and the limbic system, which are parts of the brain that helps regulate the emotions. Second factors that you're speaking about psychological factors. This can be related to traumas and stresses, basically significant traumas such as abuse, loss of a big life change, and causes that worsen depression. Also, we're speaking about negative thinking patterns, which is persistent negative thinking, low self-esteem, and perfectionism can all lead to development of depression. One of the other common factors we're speaking about is environmental factors. When you're speaking about environmental factors, we're speaking about childhood challenges, which can be something like neglect, trauma, and family conflict can also rise the risks of depression in life, later on in life. Also, a lack of social support. A lack of social support or poor connections with family and friends can exhibit feelings of loneliness and sadness. But also, one of the most common factors in this case in the environmental factors will be your socio-economical factors, which is financial troubles, unemployment, housing insecurities. All these factors, they actually increase your risk of stress, which increases the risk of depression. In some cases, medical conditions and medication can be the most common factor of depression, the most common cause. Basically, chronic illnesses and certain medications like drugs, steroids, and corticosteroids, right? So basically, that's why psychiatrists will always want a patient to first be seen by a GP in a hospital where they do baseline plans and basic assessments to exclude any medical conditions before psychotherapy or psychiatrists can actually see the patients in this case scenario. And then we're moving on to another common factor, and this is very common in young adolescents and adults nowadays, which is substance abuse. By substance abuse, we're indicating things such as alcohol, narcotic, prescribed pharmaceuticals, and sometimes all these things that can either cause or aggravate depression symptoms. As these substances, they affect the brain chemistry, which affects those neurotransmitters we spoke about. When you're looking at depression, we speak of different types, which says there are many different types. So we'll just be looking at a few today that you can have unique features. We're speaking about MDD, which is a major depressive disorder, which is basically characterized by a persistent feeling of sadness or lack of interest in activities, along with other symptoms that interfere with daily life, right? MDD, the most common type of depression. And then we speak of persistent depressive disorder, which is dysthymia, and a chronic form of depression lasting 2 or more years with milder but long-lasting symptoms. Then we're speaking about a bipolar disorder, which is bipolar depression. Involves episodes of depression alternating with periods of mania or hypomania characterized by elevated moods, increased energy, and impulsive behavior. But however, when a patient is bipolar and they fall into the depressive state, their mood is very low. They want to isolate themselves. They have hypomania. They don't want to interact. Basically, that is severe depression. And then you also have a thing called seasonal affective disorder, which is SAD. Now, this depression occurs at specific times of the year, especially during the winter month when there is less natural sunlight, which indicates that the weather controls the mood of the individual, right? Then we have one of the most common depressions, which is most cases missed in the antenatal cases. This is called the postpartum depression, which is PPD, a depression that occurs after childbirth, characterized by a feeling of sadness, anxiety, and exhaustion. Basically, this is a stage when the mother feels a very severe disconnection to the baby after the child is born and has lack of interest to the baby or anything like this, which is a very high risk for a person that just had a child because they can abandon the child, they can neglect the child, and most commonly, patients that go through antenatal care need to be assessed for risks of this postpartum depression, right? So it is very important to understand that depression is caused by a variety of elements that interact with one another. Furthermore, not everyone who's experiencing risk factors develop depression. Some people are just sad, and they don't have risks for this. So here's a question. Based on the information you have so far, what do you think are the signs and symptoms of depression? Take a minute and jot that down. So I'm just going to go through the most common signs and symptoms of depression, right? Depression symptoms may differ from person to person, but basically most of them they include the following: person feeling the person always feels sad, the person feels empty, and sometimes feel hopeless, right? They have loss of interest or enjoyment in most activities, changes in appetite and weight, sometimes patients have insomnia or they sleep too much. They might also experience things such as fatigue or lack of energy, sense of worthlessness or guilt, difficulty focusing and making judgment, irritation and restlessness, and some cases, most highest risk patients, they've like to form and have suicidal ideations. From suicidal ideations, they have homicidal ideations also in some cases. When they are suicidal, they are high risk patients and they need to be admitted to a facility as soon as possible, right? So all of these signs and symptoms are symptoms that a person just feels as if they want to shut the world out and isolate and basically exclude themselves because now they're always feeling sad, they're always feeling guilty, they're always feeling irritable, they don't feel worthy anymore. So all these things combined, they describe a sad person, which means this person needs to be supervised and assessed all the time. So now when you're speaking about these patients that have depression, before you're able to diagnose them, there needs to be a few assessments that are done. And on admission, the nurse's role is very vital, whereby the nurse is the one that first admits the patient, basically by doing an evaluation of the patient, obtaining history, information about the patient, presenting symptoms, and psychosocial issues, right? So when you are the nurse and you're admitting the patient, you do a thing called an MSE by assessing the patient's mental status examination using a systematic approach where we assess patient's appearance, the mood, the orientation, the suicidal risk factors, very important, homicidal risk factors, also very important, memory, form of hallucinations or delusions, as all these factors play an important role in diagnosing the patient and having an intervention process for the patient. So, now we're speaking of one other assessment and diagnosis when it comes to these patients. As a nurse, we have a very important role when it comes to the collaborating with the interdisciplinary team, which is the MDT meetings. Because ideally, on regular basis, when it comes to psychiatric facilities, the doctors, the nurses, the psychologists, the OT therapists, the social workers, they all meet together on a weekly or daily review to review the patients and see their progress of how the patient is since admission, right? But since now that the patient is mostly in the care of the nurse, it is very important that the nurse is the one that's in these meetings because they can give more feedback on any progress the patient makes, any abnormalities they noted, daily changes in patterns, eating, their mood, their sleeping. You as the nurse, you are always in the ward, so you are the one that provides the most information. So it is very important that you do assessments on your patient, MSE, daily MSEs also. So once the patient is diagnosed, right, and then based on the psychiatrist's diagnosis, it's seen that the patient has depression, there are a few treatment options that could take place, right? We're speaking of pharmacological interventions, which is pharmacotherapy, whereby a patient is given antidepressants, medication. So these medication, what their role is, what they do is they basically go back and cause they rebalance that chemical neurological neurotransmitter imbalance which is happening in the brain. Those hormones we spoke about, the serotonin, noradrenaline, those hormones, when they're depleted in the brain, they need to be re-elevated. So now the patients are given medications such as serotonin reuptake inhibitors, which prevents the brain from getting rid of these serotonins in the brain and elevating these hormones in the brain, which means now they'll be elevating the happiness of the patient. So I say it increases the happy hormone. So that's pharmacotherapy. Ideally, the most important part of pharmacotherapy also that if a patient presents anything of such as hallucinations, delusions, risk of isolation, patients has a low mood, the medication is supposed to elevate the patient's mood, reduce any form of suicidal ideations, also changes and decrease any form of hallucinations and auditory or visual hallucinations, so that when the part of psychotherapy commences, the patient has a clear set of mind to actually start engaging and communicating with the psychologist and OT. So once pharmacotherapy is in place, then the patient can move into another process called psychotherapy approaches, which is basically one-on-one sessions and communicating with the psychologists, social workers, or the nurses, right? Ideally, in psychiatry, you cannot fix the brain, but you can balance it and then also try to help the patient regain their confidence and regain who they are by communicating, which is psychotherapy, right? And then we're speaking about also lifestyle modification. When we speak about lifestyle modification, we're speaking about exercise, nutrition, and sleep hygiene, right? And then there are other alternative therapies such as TMS and ECT. When you're speaking about TMS, we're speaking about a very new modernized procedure called transcranial magnetic stimulation, and also ECT is electroconvulsive therapy. Basically, what these two therapies do is that they stimulate certain parts of the brain which triggers and controls these emotions. So if a person is depressed, they'll be properly focusing on the limbic system or the prefrontal cortex, basically just to stimulate it and reboot those areas, right? So when you're speaking about the previous, when we looked at the previous slide, we mentioned that there's a thing called sleep hygiene, right? What does this mean? What do you mean when you hear the term sleep hygiene? Think about it for a second. Does it mean bathing? Does it mean that you need to be clean before you sleep? What exactly does it mean? Okay, so let me explain this to you. Basically, sleep hygiene is by establishing a regular bedtime routine, whereby you're creating a calming routine and maintain a comfortable sleep environment to promote better quality sleep, right? So patient turns off all lights and electronics devices and lays in bed in a dark and quiet room, which causes the brain to release a hormone called melatonin. This hormone is released by the brain to the response of darkness. It basically helps with sleep disorders, and patients with depression most commonly are affected with insomnia. So this benefits them a lot. It benefits them a lot. So based on the signs and symptoms, including the treatment options, what do you think as a nurse would be your role or interventions to help a patient with depression? Quickly jot those down. So, ideally, with nursing interventions and care management, there are a few things that nurses could ideally do. So the roles of the nurses in caring for patients with depression involved therapeutic communication techniques, whereby you first have to communicate with the patient in a very respectful and harmonious way to build a good relationship with the patient, but also in the process teaching the patient therapeutic communication techniques and coping mechanisms, right? So basically, you as a nurse also, you need to be able to assess your patient for suicidal risk assessments and management. If a patient is a high risk with high suicidal ideations, you need to supervise and continuously watch that patient, because he's a high risk and can hurt themselves at any given time. Basically, also, when it comes to the MDT team, you have a vital role in it. You have to be the one that always advocates for your patient, which comes back to one of the most important interventions that you as a nurse can do is when you advocate for your patient. Because don't forget, sometimes patients with mental health issues cannot speak for themselves, as they are unable to express themselves, and sometimes they are misunderstood by a lot of professionals. So you as the nurse, you create that relationship with your patient so that they can be able to be heard through you and understood through you. One of your interventions also, once you've advocated for your patients, you also need to educate your patients. When you educate your patients, you need to let them know. You educate them and their families, because don't forget, the family plays a very important role in supporting this patient. Alright, so now when the patient understands what they have, the family also needs to understand what the patient suffers from. And when the patient understands what they suffer from, then you will have a compliant patient. So, here's a question. Why did the depressed mathematician refuse to use the square root? Because he was tired of feeling irrational. Okay, so basically, in conclusion, nurses play a critical role in assessing, diagnosing, and providing comprehensive treatment for depression. Let us continue to advocate for mental health patients, and they basically promote awareness and offer compassionate support to people affected by depression. Be kind to yourself and those around you.
Okay, let's go.